The temp nurse. That's what they called her when they bothered to call her anything at all. Rachel Torres moved through Oak Creek Memorial's ER like she was already a ghost, the kind of person you forgot the moment she left the room. The fluorescent lights hummed their monotonous dirge overhead as she restocked the crash cart in Bay 4, her fingers counting supplies with the mechanical precision of someone who had done this 1,000 times before. 4 epi. 6 atropine. 2 defib pads. The inventory lived in her hands before it lived in her mind. She wore scrubs 2 sizes too large, intentional, a way of taking up less space, of being smaller in a profession that already treated temp nurses like equipment rather than people. Her dark hair was pulled back in a regulation bun so tight it made her scalp ache, the kind of pulled back hair that whispered discipline to anyone paying attention. Most people weren't. The ER at Oak Creek Memorial in Denver hummed with the rhythmic chaos of a Tuesday night, ambulance sirens wailing in the distance like wolves circling a campfire, the constant percussion of monitor alarms, the mechanical whoosh of pneumatic doors opening and closing. Rachel's worn combat boots, leather cracked and stained with Helmand sand that never quite washed out, were hidden beneath the hem of her scrubs, laces double-knotted the way she had learned them 14 years ago when the Navy taught her that loose equipment cost lives. In her locker on the 3rd floor, tucked beneath a spare pair of scrubs and a dog-eared paperback she never read, those boots sat waiting like a secret. She touched them once before each shift. Just once. A ritual she didn't examine too closely, the kind of habit that kept her tethered to something she wasn't supposed to remember. Rachel was 37 years old and officially nobody. Her service records had been erased 3 years ago, redacted, buried, classified into oblivion after a mission in Kandahar that went sideways so badly the Navy decided it was easier to erase the people involved than explain what happened. Senior Chief Petty Officer Rachel Torres ceased to exist on a Tuesday afternoon in 2021. What remained was a woman with a temp nursing license and a limp that only showed up when she was tired, moving through Denver's healthcare system like a ghost with a stethoscope. She had saved 18 soldiers in 72 hours during that last operation. 18. She knew their names, their hometowns, the way each one of them looked when they stopped screaming and started breathing again. She could close her eyes and see their faces, could catalogue every wound she'd closed, every tourniquet she'd tied, every time she'd held pressure on a hemorrhage while rounds came in closer and closer. The Navy had given her a Navy Cross and then given her nothing, no discharge ceremony, no goodbye, no explanation beyond a classified folder and a lawyer's stern advice to never speak about Helmand Province again. So she didn't. Instead, she worked nights at Oak Creek Memorial as a temp nurse, the kind of position that required no background check worth a damn because temp agencies didn't ask questions about work history beyond what was on a resume. She moved through the ER with a kind of quiet competence that made people uncomfortable, the way she could assess a patient's airway and breathing before the attending physician finished asking their name. Her fingers moved with the muscle memory of a combat medic, steady and efficient, unstoppable. But she wore that competence like camouflage, kept it small, kept it invisible. Being noticed was dangerous. Being remembered was worse. The night shift crew at Oak Creek barely acknowledged her beyond functional necessity. The charge nurse, Patricia, had stopped trying to include her in break room conversations after the 3rd time Rachel didn't respond. The senior nurses saw her as the temporary, replaceable, not worth the energy of genuine friendship. Rachel refilled saline bags at 2 in the morning while they gossiped about residents and hospital politics. She charted with meticulous precision, every notation exact, every medication count accounted for down to the milliliter. She worked 12-hour shifts, sometimes picking up doubles, moving through the hospital like water through a sieve, present but not intrusive, helpful but not presumptuous. What none of them knew was that her charting was so precise because she had learned to document under circumstances that required absolute clarity. Combat medic records in forward operating bases had to be perfect. Triage assessments in mass casualty situations demanded accuracy that could save or cost lives. Rachel's charts were masterworks of clinical documentation, the kind that a medical reviewer would read and think, whoever wrote this knew exactly what they were doing. But a temp nurse with perfect charting was suspicious. Perfect charting from a nobody required explanation. So she made them slightly less perfect when she could, softened them just enough to seem human, to seem temporary. It was another kind of camouflage. Dr. Marcus Hargrove arrived for morning rounds at 6:45, 5 minutes earlier than necessary, his monogrammed white coat pristine and starched like an admiral's uniform. He was 53 years old, perpetually tanned from his country club, his silver hair combed back with the confidence of a man who had never been told no by anyone who mattered. His watch was an Omega Seamaster, $14,000, the kind of watch you wore to prove you could afford to wear it. He made his living the way he made his golf handicap, through connections and deception, through an intricate network of kickbacks and phantom billing procedures that moved through Oak Creek Memorial like a virus. His partner in crime was a medical supply vendor named Patterson who sent him $50,000 a month in unmarked checks and told him it was a consulting fee. It wasn't. Hargrove glided through the ER with his entourage of residents trailing like remoras behind a shark, and he made a joke about his golf handicap to Patricia, the charge nurse, who laughed too loudly. He was the kind of man who expected laughter. His presence made the fluorescent light seem dimmer and the air pressure change, a spreading cold that moved outward from his center the way cold spreads from an open freezer door. Rachel kept her head down as she restocked a medication cart in Bay 6, her fingers moving methodically, her expression arranged into the practiced neutrality of someone who was not there at all. Hargrove noticed her exactly once, that moment when his eyes passed across her face like a searchlight across fog, registering nothing, seeing nothing, dismissing her into the category of people who were interchangeable. Just the temp. Just another pair of hands. He had no way of knowing, as he laughed with Patricia about breaking 80 on the front nine, that the woman in the oversized scrubs had once held a man's intestines in her hands while artillery fire shook the bunker around her and she kept him alive anyway. He couldn't have known, because knowing would have required seeing her as something other than background noise. Rachel finished restocking and moved to Bay 5, where she was assigned to assist with a medication inventory count. The ER ran on medication, morphine, propofol, etomidate, fentanyl, thousands of doses moving in and out of dispensaries every shift, tracked by DEA regulations that tolerated no errors. Rachel pulled the inventory log on her tablet and began the process of reconciling what the computer said was in the medication safe with what actually sat in the medication safe. Vial by vial. Syringe by syringe. It was methodical work, the kind that most nurses hurried through, checking boxes and moving on. Rachel did it the way she had done ammunition counts in Kandahar, with perfect precision, because mistakes killed people. That's when she noticed the discrepancy. Morphine 10 mg ampules. The system showed 24 units dispensed over the last 3 days, but Rachel's count found only 19 remaining in the safe. 5 units unaccounted for. She pulled up the medication administration record and cross-referenced the dispenses against the nursing notes. For doses showed as given to patients in Bay 2 and Bay 4. One dose had no corresponding patient documentation. No patient name. No time. No clinical indication. Just gone, written off the inventory as if it had evaporated. She ran the count again, assuming she had miscounted. The same result. For accounted for. 1 missing. Rachel's hands went very still. This wasn't just a counting error. This was theft, or diversion, or something worse. Morphine was controlled substance, the kind of drug that required documentation for every single unit that left the pharmacy. The kind of drug where 1 missing vial triggered reports and investigations and questions from the DEA. Rachel had filled out those reports before, in her previous life, when surgeons would steal doses for personal use or sell them to dealers outside the wire. She knew what it looked like. She sat with the discrepancy for a moment, thinking. Reporting it would mean paperwork, would mean attention, would mean being noticed. It would mean her name on an incident report. It would mean questions about her charting, her count, her procedures. Being the temp nurse who flagged medication theft would make her visible in ways she couldn't afford to be visible. But not reporting it meant being complicit in whatever was happening in those missing doses. It meant letting someone steal controlled substances right in front of her while she said nothing. Rachel had made harder decisions under worse circumstances. She documented the discrepancy in the system and sent a message to Patricia, requesting that it be addressed during morning rounds. Then she continued her shift with the same mechanical precision she had maintained for 3 years, present but not intrusive, helpful but not presumptuous, existing in the hospital the way a ghost exists in a house. There. But not really. Morning rounds began at 7 o'clock. Dr. Hargrove moved through the bays with his residents trailing, reviewing patients with the efficiency of someone who had learned to care just enough to not be sued. Rachel was in Bay 6 with a 68-year-old patient named Mr. Chen who had presented with appendicitis during the night and was scheduled for surgery. She had changed his dressing, started a second fall line, and was reviewing his vital signs when Dr. Hargrove arrived. The patient's family was there, his daughter and his grandson, both looking exhausted and worried the way families did at 7 in the morning after their father had spent the night vomiting in pain. Rachel had rewrapped Mr. Chen's abdomen with fresh gauze and surgical tape, securing the fall lines and the nasogastric tube with the kind of careful attention that prevented complications. The bandaging was correct, secure without cutting off circulation, organized without being excessive, the kind of clean work that any competent nurse would produce. She had learned proper bandaging technique in the Navy, had practiced it in field conditions where infections killed people as surely as any wound. Her work was professional. It was textbook. It was exactly what it should be. Dr. Hargrove glanced at the bandaging and then looked at Rachel with something that might have been amusement in his eyes. He turned to his resident, a young man named Dr. Patterson who was still soft enough to believe that medicine was a calling, and said, loudly enough for the patient's family to hear, that bandaging is improper. The tape is oriented incorrectly. The gauge folding creates unnecessary bulk. This is first-year error. Show her the correct technique, Patterson. The room went quiet. Not the gentle quiet of a person being corrected. The suffocating quiet that follows public humiliation, the kind of silence where everyone is aware that something unkind has just happened and no one is going to address it directly. Mr. Chen's daughter stared at her father's bandaging. His grandson looked at Rachel with something like pity. The residents shifted their weight uncomfortably, the way people do when they witness a shark feeding. Rachel didn't flinch. She didn't feel the heat rise in her face the way younger nurses did. She didn't retreat or apologize or attempt to explain. She simply met Dr. Hargrove's eyes with a gaze so flat and empty that it was like looking into a void, and she said nothing. The silence lasted exactly 3 seconds. Then she began carefully removing the tape from Mr. Chen's abdomen, moving with methodical precision, and she said to the resident, "Show me what you would do, Dr. Patterson." The resident fumbled through his correction, and Rachel listened without interruption, her face arranged in an expression of professional acceptance. But her hands, as she helped rewrap the abdomen, moved with the muscle memory of someone who had trained under combat surgeons who tolerated no errors. Her bandaging had been correct. They both knew it. Dr. Hargrove knew it, which was why the correction was designed not to improve patient care but to establish dominance, to remind Rachel of her place in the hierarchy of Oak Creek Memorial, to make sure she understood that she was beneath his notice but not beneath his contempt. When the rounds finished and the doctors moved to the next bay, Rachel completed the dressing change and checked Mr. Chen's vitals one more time. His heart rate was elevated, anxiety from the pain and the pre-surgical stress, but within acceptable range. She documented everything with the precision she had maintained for 14 years, every detail exact, every notation clear. Then she went to the break room and sat alone with a cup of coffee that had been made hours ago and had gone cold. The break room smelled like reheated coffee and fluorescent hum, that particular electric buzz of Oak Creek Memorial's aging infrastructure that most people stopped hearing after their first week. Rachel sat alone at the corner table, her homemade sandwich unwrapped, a medical journal open to an article on sepsis protocol she'd read 3 times already. The clock above the sink read 2:17 p.m. Peak shift change. The room had been full 5 minutes ago, 8 nurses gathered around the scheduling board, someone complaining about a 12-hour extension, another talking about a baby shower scheduled for next month in Boulder. Normal sounds. The sounds of people who belonged. Then Rachel unwrapped her sandwich. It wasn't loud. Just the crinkle of aluminum foil, the soft click of her water bottle being set on the plastic table. That's all it took. One nurse stood, saying she'd forgotten something in her locker. Another checked her phone, muttered about a text, and followed. Within 30 seconds, the break room had emptied like someone had opened a valve and drained it. A respiratory therapist passed the doorway, so Rachel sitting alone, and quickened his pace down the hallway. The charge nurse, Sandra, who Rachel had helped with a difficult for insertion 3 days prior, glanced in, made eye contact for exactly half a second, then looked away and walked toward the supply area as if she hadn't seen anything. 90 seconds of choreography. Rachel had learned military timing well enough to recognize it. This wasn't accident. This was orchestration. She took one bite of her sandwich. Chewed slowly, deliberately, her jaw working with the precision of someone performing necessary maintenance on her own body. The lettuce tasted like nothing. She swallowed, turned a page in her journal, and lifted her water bottle to her lips. Her hand shook slightly, just a tremor, barely visible, the kind of involuntary response her body produced before her mind could lock it down. She set the bottle back on the table with controlled care, making no sound. The fluorescent bulb above her flickered its nervous stutter, on and off, like a dying heartbeat. Rachel sat in that silence and finished her sandwich one methodical bite at a time, the journal open in front of her, the words dissolving into abstract shapes because her eyes had stopped processing language. When she finished eating, she rose, disposed of the aluminum foil in the trash, rinsed her container at the sink, and walked back to the unit. No one had returned to the break room. That's when she understood Hargrove hadn't just humiliated her in front of patients and their families. He'd isolated her from the only informal space where staff gathered without hierarchy. He'd made sure that every moment of her break would be spent with her own thoughts and the awareness that 8 other people had chosen to leave rather than share a room with her. The formal write-up appeared the following morning on the unit bulletin board beside the staff schedule, printed on official Oak Creek Memorial letterhead and posted where every employee did their time clock punch. Rachel read it while clocking in for her night shift at 6:33 a.m., before the day shift had fully cleared out. The paper was white, the ink black, the words precisely those that would appear in her permanent personnel file. Disciplinary action, R. Torres. Multiple infractions including failure to follow established medication documentation protocols, inability to integrate with team culture, and substandard patient interaction skills. Recommended remediation, formal retraining or reassignment. Dr. Harrison Hargrove, ER Director. Hargrove hadn't filed this privately. He'd displayed it publicly, the professional equivalent of mounting a head on the castle wall. Every nurse who clocked in would see it. Every respiratory therapist, every CNA, every physician's assistant would read those words and understand the hierarchy, that Rachel Torres was a problem, that Hargrove had documented her as a problem, and that her continued presence at Oak Creek Memorial was provisional and diminishing. She read it twice. Her face remained absolutely still, a smooth mask that revealed nothing of the sound her mind made, which resembled the sensation of being hit in the solar plexus while standing completely underwater. A respiratory therapist she'd never spoken to passed by, saw the post-it section with Rachel's name, and muttered, harsh, as if offering sympathy rather than confirming isolation. Rachel nodded once, clocked in with her badge, zipped the credential into her scrub pocket, and walked directly to the supply closet. The supply closet occupied a narrow space off the main pharmacy, cardboard boxes stacked floor to ceiling, the smell of sterile packaging and the plastic metal tang of for tubing, shelves containing gauze in 1,000 configurations, Foley catheters color-coded by size, topical ointments in labeled containers the size of a child's fist. Rachel stepped inside, closed the door, and allowed herself exactly one tear, which ran down her right cheek in a single vertical track before she caught it with the back of her hand. She breathed in through her nose, out through her mouth, 5 times, until her vision cleared and her hand stopped generating that involuntary tremor. 2 minutes. That's all she took. Then she opened the door, restocked the medication drawers with fresh fur bags, checked the inventory on the crash cart, and returned to the unit with her face reset to neutral and her spine aligned with the kind of posture that made her shoulders look narrower, smaller, less threatening. She did not cry again that day or the next. Thursday morning arrived with the 6 a.m. shift change, and the medevac helicopter landed on the roof at 3 a.m. with an Army sergeant first class named David Reyes, evacuated from Helmand province with shrapnel wounds that had required 3 days of initial stabilization at Peterson Space Force Base before transfer to Denver. The alert came through as a radio call: incoming trauma, 42-year-old male, multiple penetrating chest wounds, stable vitals, ETA 12 minutes, and Rachel was assigned to his pre-op workup in Trauma Bay 2. When she entered the room, something shifted. She felt it immediately, the way a seismograph detects tremors before they become earthquakes. Reyes lay on the gurney, his broad chest exposed, heavy bandaging across his left shoulder and ribs, his eyes tracking her as she approached. He was conscious but sedated, morphine making his pupils large and distant, but something in his gaze locked onto her the moment she began her assessment. She worked in silence, blood pressure cuff around his left arm, pulse oximeter on his right index finger, for check on the line running into his right wrist. His vitals were acceptable. BP 128/79. O2 sat 96 on room air. Heart rate 92, elevated but understandable for a trauma patient in pain. Then she inspected his chest wound. The bandaging from Peterson had been field-level work, functional, appropriate for forward operating base medicine. Rachel peeled back the outer layers, assessed the wound tract for signs of infection or dehiscence, and began preparing the area for the surgical team that would be heading into the operating room within the hour. She irrigated the wound with normal saline, the fluid running clear, and debridged the wound edges with meticulous attention to the deepest margin, removing the devitalized tissue that would compromise healing. Her hands moved in a specific pattern, not the way modern civilian trauma medicine taught, but the way a medic learns when temperatures exceed 110 degrees and infection kills faster than bleeding. She applied the antimicrobial gauze first, then the pressure padding, then the crosshatch tape pattern, diagonals crossing at precise angles, creating even tension across the entire injury site, a technique that prevented tension blistering in extreme heat. The stitch itself was old, taught to her in a room at Fort Sam Houston 13 years ago, refined in places that no longer existed on military maps. Reyes watched through his sedation haze. His eyes, which had been distant, suddenly focused. His morphine-dulled consciousness cut through the drug fog like a knife blade finding its edge. His lips moved, forming words that barely had volume. Rachel leaned closer, her ear near his mouth, catching the whisper, "That's a Kandahar stitch." Only combat medics know that angle. The crosshatch prevents tension blistering in 100-degree heat. Rachel's hand stilled for exactly one fraction of a second. She met his eyes, really met them, the way two soldiers recognize each other across a room full of civilians. Then she straightened, her voice dropping into the tone she used for discharge patients and routine orders, "You need to rest, Sergeant." She continued her charting without another word, documenting his vitals and wound status with the same precision she brought to every task. But Reyes kept staring, his hand reaching weakly across his body toward her name badge, the letters printed in small font, R. Torres, RN. "Who are you?" he asked, his voice rough with sedation and something that sounded like recognition. "Nobody," Rachel answered, and paged the surgical team. In the hallway outside Trauma 2, Dr. Hargrove intercepted her before she'd made 10 steps. He held a medication count discrepancy form, the paper already filled out in his precise handwriting. His cologne arrived before he did, something expensive that smelled like arrogance distilled into fragrance. 3 vials of fentanyl short on last night's audit, he said, his tone casual but his eyes measuring her face for reactions. "You were the only one with access to the crash cart between midnight and 4 a.m. I'll need an explanation." Rachel looked at the form, then at Hargrove. His smile existed but didn't include his eyes. When she spoke, her voice carried the same tone she'd used on Reyes, a flat line of professional calm. "I documented every medication administered. Check the electronic log." She didn't ask. Didn't defend. Didn't offer apology or excuse. She simply stated fact. "I did check," Hargrove replied, his smile widening in a way that suggested he was enjoying this moment. "There's a gap. The log doesn't match the dispensing records." We'll be investigating. He held the form out toward her. You'll need to sign this. Rachel took the clipboard, read the form a second time, then signed her name in the space provided. Not in agreement. Signing doesn't mean agreement, only that you've received notice. She handed it back and held his gaze for one measured breath. In that second, before she looked away, something flickered across her face, not anger, not fear, but a recognition of pattern. This wasn't about medication discrepancies. This was architecture. Hargrove was building a structure, brick by brick, designed to collapse on her. The humiliation in front of patients. The isolation in the break room. The public write-up. The medication audit. Each element separate, but all of them moving in the same direction, all of them designed to document her as unstable, unreliable, a liability that Oak Creek Memorial would be justified in removing. Hargrove walked away, and Rachel stood in the hallway while the fluorescent lights buzzed their electric stutter overhead. The morning shift was beginning to arrive. Normal sounds. Normal chaos. Normal people moving through a hospital that would forget her by the end of the week, would adjust to her absence the way water adjusts to a stone being removed, closing around the empty space until there's no evidence anything was ever there. But that wasn't quite right. Someone had been watching. The charge nurse, Sandra, the one who had looked away in the break room, had been passing the hallway during the medication count exchange. She'd heard Hargrove's accusation. She'd watched Rachel's response. And something in that exchange had triggered a question that wouldn't release. Sandra waited until Hargrove was gone, then approached Rachel with her voice low and her posture turned slightly away from the central nursing station, as if their conversation was incidental rather than intentional. That medication discrepancy, she said quietly. I know you didn't take anything. I saw your documentation. The logs in the computer, and every dose you pulled is recorded against a patient. She paused, choosing her next words with care. Something else is happening here. I don't know what it is, but I see it. And I'm not the only one. The medevac helicopter descended through Denver's midnight sky at 0300 hours, its rotors shaking the windows of Oak Creek Memorial's roof access corridor. Rachel heard it before she saw it, the distinctive thump-thump-thump of a UH-60M Black Hawk cutting through the silence like the sound of inevitability arriving. She was restocking the trauma bay when the overhead speaker crackled, incoming from Helmand Province, Army Sergeant First Class David Reyes, shrapnel wounds to the left flank, 2 units of blood already running, ETA for minutes. The trauma doors burst open and the stretcher rolled through, Reyes's uniform still caked with desert dust, his left side wrapped in field dressings that were already bleeding through. 3 combat medics flanked him, their movements precise and economical, the kind of efficiency that came from having done this exact thing under fire. Rachel watched as they transferred him to the trauma bed, calling out vitals in the clipped shorthand of people who had learned to communicate in chaos, BP 118/82, heart rate 94, O2 sat 98 on 2 liters, alert and oriented ×3. Reyes's eyes tracked the room even as the attending physician began the examination, his pupils tracking movement like a predator mapping terrain. She shouldn't have been assigned to his follow-up CT scan. But the ER was understaffed at 0400, and when Hargrove saw Rachel standing idle, his voice came through with that familiar edge, Torres, take Reyes to imaging. Try not to contaminate anything. The way he said her last name made it sound like an accusation. In the CT suite, Rachel positioned Reyes on the scanner bed with the kind of careful precision that someone uses when they understand that one careless movement could cost a man a rib or reopen a wound. She worked in silence, guiding his positioning, calling out breathing cues that patients actually heard instead of ignoring. As she adjusted the straps, her hands moved with automatic efficiency, tactical spacing of the fingers, angle of approach, visual confirmation before pressure. The kind of muscle memory that didn't come from nursing school textbooks. Reyes's eyes opened wider. Not in pain. In recognition. Combat surgical team, he murmured, his voice rough from morphine and altitude change and the weight of things he'd seen in places most people would never comprehend. CST transfer. I've seen that in field hospitals. Kandahar. Camp Dwyer. He paused, his eyes locking onto hers with the intensity of someone trying to place a face from a memory he wasn't sure was real. You. Rachel didn't let him finish. Just a nurse. Her voice came out flat. Controlled. The voice of someone who had learned to swallow entire identities. But Reyes was already sliding back under the sedation, and as his eyes closed, she saw something shift in his face, not confusion, but comprehension. The kind of understanding that passes between people who have stood on the same battlefield and walked away alive. They were connected now by something nobody else in this hospital could see. The appendectomy was scheduled for 0630 the following morning, a surgical complication discovered during the CT scan when Dr. Patterson, the attending surgeon, spotted what looked like appendiceal inflammation unrelated to Reyes's combat injuries. Rachel was assigned as surgical nurse assist, and when she arrived in the pre-op area to confirm Reyes's consents and medications, Dr. Hargrove was already there, leaning against the counter with the posture of someone making sure she knew he was watching. "Trying not to contaminate the field today, Ghost," he said to her, not bothering to look up from Reyes's chart. He used the nickname the way other people used a knife, casual, deliberate, designed to remind her that she was nothing here, that he could reduce her to a whisper anytime he wanted. Rachel didn't respond. She never did anymore. She simply continued her pre-op assessment with Reyes, checking his vital signs, confirming his medications, running through the surgical protocol as if Hargrove wasn't standing there radiating hostility like heat off asphalt. Reyes watched her work, his eyes following her hands, and she caught him studying the rhythm of her movements, the way she anticipated each step before needing to ask for it. The OR was the kind of controlled environment where everything made sense, sterile field, clear hierarchy, instruments arranged in order of need. Rachel moved through the setup with the automatic precision of someone who had done this 1,000 times, but never in this kind of sterile environment. Never with this kind of backup. Her hands positioned the instrument trays, checked the suction lines, confirmed the counts with the circulating nurse. Dr. Patterson arrived at 0645, his presence filling the room with the kind of authority that came from decades of knowing exactly where every organ should be and what happened when they weren't. Scalpel, Patterson said at 0702, and Rachel was already moving, the instrument in his hand before he'd finished the word. Handle first. Visual confirmation. The kind of transfer that belonged in a trauma tent in Helmand province, not in the gleaming sterility of Denver's premier surgical suite. Patterson paused. His eyes came up from the incision site. "That's interesting," he said. "You're using a tactical pass, handle first with visual confirmation. Where'd you learn that?" His tone wasn't accusatory. Just curious. The way someone asks a question when they've recognized something unusual and want to understand it. Rachel's jaw tightened. Not from fear. From the effort of restraint. She opened her mouth to deflect, to offer some generic explanation about efficiency, about doing things in a certain order. Reyes's voice came from the surgical field, low and dream-clouded beneath the spinal anesthesia that let him remain conscious during lower abdominal surgery. Combat surgical team. That's a CST transfer. I've seen it in field hospitals. 3rd Battalion, 5th Marines. They save your life when. His voice trailed off into morphine confusion, but the damage was already done. The words hung in the sterile air like a diagnosis. Patterson's hand stilled for a fraction of a second. Then he continued the appendectomy as if nothing had happened, but Rachel felt the shift in the room's attention, subtle, professional, but absolutely present. In her peripheral vision, she saw Dr. Hargrove in the observation gallery lean forward, his entire body suddenly focused like a predator that had caught the scent of something wounded. The surgery took 43 minutes. The appendix was inflamed but unperforated, which meant straightforward removal without complications. Rachel moved through the procedure with the kind of mechanical precision that comes from doing something so many times that thought becomes unnecessary. Retract. Suction. Clamp. Tie. Her hands were steady as a surgical laser, anticipating Patterson's needs, moving instruments to his palm before he asked for them. When they closed, running suture on the fascial layer, subcuticular closure on skin, Patterson looked at her once more and nodded. Not approval. Acknowledgement. The kind of nod that said, I know what you are. Post-op recovery should have been routine. Reyes was moved to surgical floor room for at 0800 hours, his vitals stable, his pain controlled with morphine, his recovery trajectory absolutely normal for an appendectomy patient. Dr. Hargrove's team took over his post-operative care, standing orders for monitoring, routine vital sign checks every 2 hours, clear discharge criteria if nothing changed overnight. Rachel returned to the ER. She tried to focus on the steady stream of patients, a laceration that needed sutures, a migraine requiring for fluids, an elderly man with chest pain who turned out to have severe indigestion. Her hands moved through the motions, but part of her attention remained on surgical 4, on Reyes sleeping off the anesthesia, on the knowledge that Dr. Hargrove now had confirmation that she wasn't just a temp nurse making minimum wage while hiding in plain sight. At 1800 hours, her pager erupted with a code blue from Surgical 4. Rachel was already moving before the overhead speaker confirmed it, her ER colleague nodding her toward the exit without needing to ask. The elevator ride felt like suspension in time, those few seconds where everything shifts and nothing is ever quite the same afterward. Her heart rate remained steady. Her breathing stayed controlled. But something ancient and trained inside her was already running through a differential diagnosis based on a 22-year-old Army sergeant who'd been stable just hours before. The post-op ward exploded into controlled chaos when she arrived. Reyes's monitors were screaming, blood pressure bottoming out, heart rate accelerating, the kind of cascade that meant something catastrophic was happening inside his chest. Distended neck veins. Pale, clammy skin. Narrowing pulse pressure with each breath. The classical triad was there, written in the vital signs like a diagnosis in neon. Cardiac tamponade. Blood pooling around his heart, compressing the ventricles, preventing them from filling. A complication unrelated to his appendectomy, something that had started in the OR or the moments after, something that was killing him in real time. Get cardiothoracic down here, Dr. Hargrove's voice cut through the room, and he was already there, already positioning himself between Rachel and the crash cart. Between her and the patient. Page the attending. Now. Rachel stepped forward. He doesn't have time. What was that? Hargrove's voice dropped to the kind of quiet that comes right before an explosion. BP 70 over 50 and falling, Rachel said, her voice steady as stone. Muffled heart sounds. Distended neck veins. Narrowing pulse pressure. He has 5 minutes, maybe less. She moved toward the ultrasound machine. I can decompress the pericardial sac with a needle. 60-second procedure. He lives? We wait for cardio? We're calling it a code. Dr. Hargrove stepped between her and the patient bed, his face flushed with rage and something that looked almost like fear. You are not authorized to perform invasive procedures. Step back, or I will have security remove you from this floor. The room had gone completely silent except for the screaming monitors. 2 nurses stared at Rachel. The respiratory therapist froze with the ambu bag halfway to Reyes's face. And Reyes's eyes were open, conscious again, watching her with the kind of intensity that said he understood exactly what was happening. Rachel met Hargrove's eyes. Held them. And said with the absolute calm of someone who had made peace with every consequence, I've kept men alive with less than what's in this room. You wouldn't understand that kind of pressure. Then she moved. She was already past him before he could physically stop her, her hands reaching for the ultrasound machine, her movements the kind of fluid certainty that comes from having done this in sandstorms and darkness and worse. The 2 nurses positioned Reyes on his back without waiting for orders, muscle memory of their own, recognizing authority when they heard it. Gloves. Already sterile from the surgical suite. The ultrasound probe finding the pericardial sac in seconds, identifying the fluid collection around his heart, confirming what his vital signs had already screamed. A spinal needle from the anesthesia cart. A 60 milliliter syringe. Rachel prepped the site below the xiphoid process, felt for the landmarks that her hands had memorized in 3 different continents, and inserted the needle at precisely 45 degrees, guided by ultrasound confirmation. The needle slid in. The syringe filled with dark, venous blood. 45 milliliters. Then 50. Then stop. The needle was out. Pressure applied to the puncture site. And Reyes's blood pressure responded in real time, the monitor climbing, the heart sounds clearing, the vital signs stabilizing in a cascade of numbers that meant survival instead of death. The room went dead silent except for the steady beep of the cardiac monitor, that mechanical rhythm that said, alive. Still alive. Dr. Hargrove's face had drained of all color. He stared at Reyes, at the monitors, at Rachel standing there with a used needle and the kind of composure that belonged to someone who had done this before, many times, in places where failure meant writing letters to wives and mothers. Cardiothoracic is in the ED, one of the nurses whispered. They're on their way up. Rachel set the syringe down on the sterile field and removed her gloves without looking at anyone. Her voice, when she spoke, came out soft enough that only Reyes could hear it. Rest. Real help's coming now. And then she walked out of the room, leaving Dr. Hargrove standing in the wreckage of his authority, understanding with absolute certainty that everything had just changed, and that the temp nurse in combat boots had just burned down the only future he'd carefully built for her. The post-op bay at Oak Creek Memorial runs on a rhythm Rachel knows by heart, the methodical beeping of cardiac monitors, the soft exhale of ventilators, the quiet efficiency of nurses checking vitals every 15 minutes. Sergeant Reyes is 6 hours out of surgery, his appendix gone, his wounds from Helmand cleaned and dressed, his vital signs stable enough that the surgical team has moved on to their next crisis. Rachel sits at the documentation station, charting his post-operative status with the precision of someone who learned to keep records in conditions where a single missing detail could mean a soldier didn't make it home. Oxygen saturation 96%. Blood pressure 120/78. Heart rate 84. Everything textbook. Everything normal. She doesn't notice the change at first because that's how cardiac tamponade works. The heart fills with fluid, the chambers compress, and the body's compensatory mechanisms kick in so gradually that you miss the moment it becomes an emergency. By the time the monitors start screaming, you're already too late. Reyes's monitor alarm cuts through the post-op bay like a knife through membrane. Rachel's head snaps up from the charting station in the same moment the nurses around her pause, listening to the rhythm coming through the speaker. The pitch is wrong. The rate climbing, 95, 105, 120. A nurse at his bedside checks his blood pressure. 65/40 and dropping. His skin has gone the color of old paper. His breathing shallow, rapid, almost apologetic. Get the resident, someone calls out. Rachel is already moving, her hand steady, her mind compartmentalizing the panic that belongs to other people. She approaches Reyes's bedside and places her palm on his forehead. His skin clammy, his eyes wide with the specific terror of a man whose body is betraying him while he watches. Talk to me, Sergeant, she says quietly, her voice the only still thing in the room. What do you feel? Chest, he gasps. Can't breathe. Pressure like, he stops, his shoulders rising with the effort of pulling oxygen into lungs that suddenly aren't working right. His fingertips are already turning blue. Rachel doesn't wait for the resident. She doesn't wait for the attending. She doesn't wait for permission or authorization or anyone's approval. Her hands are already moving toward the crash cart, muscle memory taking over, 3 years of civilian life evaporating in the span of a single heartbeat. She pulls the ultrasound machine from the corner of the post-op bay and positions the probe over his chest, looking for the fluid that she already knows is there, filling the pericardial sac like water in a drowning man's lungs. There. Dark shadow around the heart muscle. Blood. Reyes's own blood, pooling where it has no business being. Cardiac tamponade, Rachel says, not to anyone in particular, just stating the fact of it the way you state the weather when there's a hurricane coming. Get me a spinal needle. 18 gauge. And a local kit. The charge nurse stands frozen. Behind Rachel, footsteps. Dr. Hargrove appears in the doorway, his face a mask of controlled confusion that cracks the moment he understands what Rachel is doing. "What are you doing?" His voice sharp, pitched high. "You do not have authorization for an invasive procedure. Step away from that patient immediately." Rachel doesn't step away. Her hands are already opening the procedure kit, already preparing the field over Reyes's chest, already locating the fifth intercostal space, the midclavicular line, the exact angle that requires you to have held a man's life in your hands while bullets cracked overhead and the screaming had faded into prayer. She swabs the skin with antiseptic that smells like 1,000 other operating theaters, like home and loss, and the only thing she knows how to do. O2 saturation dropping, someone reports. 84%. 80%. 76. Blood pressure undetectable, another voice, younger, frightened. "I said stop," Hargrove says, moving toward Rachel, his hand reaching out as if to physically pull her away from the patient. "This is a liability nightmare. You are not cleared for this." "Security. I want security up here now." Rachel's hands don't hesitate. The needle goes in with the confidence of someone who has performed this procedure while lying in the mud of a schoolhouse destroyed by shrapnel and artillery, while her hands were shaking not from fear but from the weight of knowing that every movement would determine whether these men saw their families again. The needle slides through muscle and membrane and finds the fluid with a hiss of air escaping, blood rushing backward through the syringe, dark and urgent. "Syringe," she says, her voice flattened into something that sounds nothing like the careful temp nurse who asks permission to use the copy machine. This is the voice of someone who has made decisions that ended wars on a small scale, decisions measured in saved lives and returned soldiers. A nurse, not the charge nurse, someone braver or more frightened, hands her a 10 ml syringe. Rachel attaches it to the needle already positioned, already perfectly placed, and draws. The syringe fills with blood. 10 milliliters. 20. 30. Each withdrawal releases pressure on Reyes's heart, and the monitor responds immediately, the rate dropping, the rhythm stabilizing, the vital signs climbing back toward the land of the living. Oxygen saturation recovering, someone whispers, their voice filled with something between shock and awe. 91, 94, and 97%. 40 milliliters of blood. Rachel stops, assesses, watches. The monitor shows sinus rhythm. 86 beats per minute. Blood pressure 92/56 and rising. Reyes's color improving by the second, his breathing deepening, his eyes clearing as oxygen returns to tissue that had begun to die. She steps back from the bedside, removes her gloves, and drops them into the trash with the same precision with which she performed the procedure. Hargrove is standing in the doorway with his phone already in his hand, his face the color of ash. "This is unconscionable," he says, his voice shaking with something that might be rage or might be the specific terror of watching someone steal his narrative. "You have no authority. No certification for that procedure in this facility. I am documenting this as a serious safety violation, and I am calling the Chief of Staff immediately." Rachel meets his eyes for exactly 3 seconds. Long enough for him to understand that she is not the woman he thought she was humiliating in the break room. That the combat boots hidden in her locker belong to a version of her he would never fully comprehend. That he has just watched her save a man's life with a technique that requires the kind of pressure that only comes from learning to make life and death decisions in a place where civilian rules don't apply. She says nothing. She simply nods once, acknowledges the facts of what is about to happen, and turns her back on him to document the procedure in Reyes's chart. But that wasn't the worst part. The worst part was what happened next. Hargrove stands in his office at 2 in the morning, his hands trembling as he holds his phone, making calls to numbers he has not used in months. Numbers of hospital board members. Numbers of men he has golfed with, men he has mentored, men who know his name and have benefited from his discretion. His voice is low, urgent, filled with the kind of concern that makes people listen. "We have a serious problem," he tells them, one by one, his words practiced, his narrative already crystallized. "There's a nurse, contract employee, no permanent affiliation, who performed an unauthorized invasive procedure today. Cardiac puncture. No attending present. No documented indication. Complete violation of our protocols. She claims it was to save the patient, but the liability exposure is catastrophic. We need her gone before this becomes a lawsuit. He pauses, listens to their responses, all of which trend toward concern and agreement and the specific fear that hospitals carry like a disease, the fear of litigation, of regulatory scrutiny, of reputation damage. By 8 in the morning, he has called the 3 references Rachel listed on her hire paperwork, asking questions designed to extract doubt. Has she ever shown signs of instability? Has she been reliable in previous positions? Any concerns about her judgment under pressure? We're trying to understand her pattern. The references, bless them, want to help. They remember Rachel. They have nothing but good things to say. But to Hargrove's ears, every neutral statement becomes suspicious. Every period of quiet becomes a gap to be filled with inference. By 9:30 in the morning, an outside consultant arrives at Oak Creek Memorial, a woman named Patricia Chen, a former hospital attorney who specializes in building termination cases so airtight that filing suit would be laughable. She sits at the conference table with Hargrove, the hospital HR director, and the chief of staff, and she opens a folder containing 3 hours of work, a timeline of Rachel's documented incidents, a summary of the medication discrepancies from the fake audit, a formal analysis of scope of practice violations, and a preliminary finding that reads like an indictment. The authorization alone is disqualifying, Chen says, tapping the document with a pen that probably costs more than Rachel makes in a week. She performed an invasive procedure without attending physician authorization. That's battery, technically. Certainly grounds for immediate termination with cause, which means she forfeits severance and any protection from bad references. Hargrove nods, and there is something like hunger in the movement. At 9:45, Rachel receives a text message. Conference room B 9:55. Termination meeting. She reads it twice, then places her phone on a dresser next to the combat boots, the worn leather cracked at the heel from 1,000 miles of walking through a place where the rules existed only in the spaces between survival and death. She changes out of her scrubs into civilian clothes, jeans, a gray sweater, nothing that marks her as anything in particular. Nothing that hints at the woman she was 3 years ago, before the Navy ordered her to become invisible. The rain started around 10 in the morning and hasn't stopped. By evening, it's hammering against Denver like it has a personal grudge. Rachel sits in conference room B at 9:55, watching Hargrove arrange papers with the precision of someone constructing a monument to his own righteousness. The HR director looks uncomfortable. Chen from the consultant firm looks exactly like someone who has executed this procedure 100 times before. Nobody looks at Rachel. Your employment with Oak Creek Memorial is terminated effective immediately, Chen reads from the document, her voice neutral, her eyes not meeting Rachel's. Cause termination due to an authorized invasive procedure, violation of scope of practice, and pattern of documented performance concerns. Your badge will be collected by security. You will be escorted from the premises. Your final paycheck will be mailed to your address of record. Rachel listens to the words pile up like snow, each one covering the last, until there is nothing visible anymore. She thinks about the 72 hours in Helmand province. She thinks about 18 soldiers. She thinks about the Navy Cross that sits in a box in her apartment, unsigned, unwitnessed, a medal earned in a mission that never happened, awarded by a government that no longer acknowledges her existence. She signs the papers, they slide toward her. She doesn't argue. She doesn't defend herself. She can't. Senior Chief Petty Officer Rachel Torres officially ceased to exist 3 years ago when the mission went sideways and the Navy made the decision that some stories were too expensive to tell, some heroes too inconvenient to acknowledge, some lives too dangerous to document. She signed a non-disclosure agreement that makes defending herself a federal crime. She surrendered her clearance and her uniform and her identity, and what she received in return was a civilian social security number and orders to disappear. I understand, she says quietly, and stands. Security escorts her out of the building at 4 in the afternoon. The rain tastes like copper when she steps outside, tastes like the dust of a place 8,000 miles away and 3 years past. She drives through Denver with no destination in mind until the GPS takes her to Fort Logan National Cemetery, the windshield wipers beating a rhythm against the downpour, and her hands gripping the steering wheel like it's the only thing keeping her tethered to a body that suddenly doesn't know how to exist in a life this small. The cemetery is mostly empty at this hour. Rows of white headstones stretch out under the rain like an army standing at attention. Rachel walks past them with her jacket soaked through, her hair plastered to her face, until she reaches the stone that matters. CPO James Torres. Beloved husband. Died in service. Engraved below his name, the date. 5 years ago. Motorcycle accident on I-25 in perfect weather, the kind of meaningless death that reminds you that survival isn't about heroism, it's about luck, and timing, and being born into a universe that doesn't care who you are or what you've sacrificed. Rachel kneels in the mud. Her jeans soak through immediately. The rain pours down like judgment. I saved that man's life, she whispers, her voice broken in a way her hands never are. That sergeant. I saved him and they're erasing me again. I don't know how to be nobody anymore. I don't know how to let them win. She places her palm flat against the cold marble of the headstone. Her wedding ring clinks against the stone, a sound so small it should disappear into the rain, but it doesn't. It echoes. I don't know how to stop being what you needed me to be, she says. I don't know who I am if nobody's counting on me to keep them alive. She kneels there for 20 minutes, the rain washing over her like baptism, like erasure, like the slow dissolution of a woman who was never supposed to exist in this world anyway. Then she stands. She touches the headstone one final time. And she walks away from the only identity she has left. The conference room at Oak Creek Memorial smelled like stale coffee and the peculiar sterility of institutional carpet cleaner. Rachel walked in at 9:51 a.m. on a Tuesday, 2 days after she'd saved Sergeant Reyes's life, and found Dr. Hargrove seated at the head of the polished table with an HR representative named Linda whose expression suggested she'd rather be anywhere else. The dismissal paperwork was already printed, stacked like an indictment. Hargrove didn't look at Rachel as she sat down. He looked at the papers in front of him with the calm satisfaction of a man holding all the cards, his fingers steepled beneath his chin. Ms. Torres, he began, his voice steady as a surgeon's hand before the incision, your employment with Oak Creek Memorial is being terminated effective immediately for reckless endangerment, violation of established medical protocols, and unauthorized medical procedures. Linda shifted in her chair. Rachel said nothing. She sat with her hands folded on the table, her breathing even, her eyes fixed on a point just beyond Hargrove's shoulder. He'd practiced this. She could tell. His cadence was rehearsed, his delivery polished. He was delivering the final blow to someone he believed was already broken. Your actions during Sergeant Reyes's post-operative period constitute gross negligence and expose this hospital to unacceptable liability. The board has voted unanimously. The door slammed open. Sergeant David Reyes stood in the frame, fur line dangling from his left arm like a question mark, hospital gown barely fastened, his bare feet slapping wet against the tile floor. He was pale as surgical gauze and moving with the kind of determination that comes from having nothing left to lose. Every person in the conference room froze. Hargrove's mouth went slack. Reyes's eyes found Rachel across the table and locked there like a targeting system. He took 3 steps forward, his movement creating the sound of water dripping from fur tubing onto linoleum, and whispered a single word that made the air in the room stop moving, Valkyrie. It wasn't her name. It was her call sign from the Helmand province operation, from the classified mission that had supposedly taken her off the books forever. Only the soldiers she'd saved would know it. Only the ones who'd been there. Rachel's expression didn't change. Not a flicker. Not a breath. But Hargrove's face cycled through 5 different colors in rapid succession, red, white, pale gray, back to red again. Before anyone could move, before Hargrove could order security or demand an explanation, the conference room door opened again and a Marine Corps officer in dress blues walked in like she owned the building. Captain Sophia Reyes, Sergeant Reyes's daughter, saluted smartly and said 4 words that ended Dr. Hargrove's career before anyone fully understood what was happening. You just fired Senior Chief Petty Officer Torres. The room went so quiet you could hear the four-bag dripping. Hargrove stood up. Sat back down. His hand moved toward the phone on the conference room table, then fell away. He'd been running on the assumption that Rachel was nobody. A temp. A ghost that could be deleted. A person whose disappearance wouldn't create ripples because she'd already been erased once. He'd miscalculated with the precision of a man who'd never understood that the quietest people in the room were often the ones holding it together. Linda from HR went pale. She began gathering the termination paperwork with trembling hands. A charge nurse Rachel had seen in the hallways, the one who'd always seemed sympathetic, who'd asked Rachel once if she was okay, really, walked in behind Captain Reyes carrying a personnel file so thick it required both hands. The nurse's name was Margaret Chen, and her voice was shaking as she read aloud from the documentation, Bronze Star for Valor Under Fire in 2019. Bronze Star for Leadership and Medical Innovation in 2020. Navy Cross for Heroism Beyond the Call of Duty, 2021. Each medal hung in the air like its own sentence. Each citation was a confession of everything Hargrove had tried to destroy. Margaret continued reading, her voice gaining strength, sustained 18 combat casualties through a 72-hour hostile engagement in Sanjan Valley. 0 fatalities. All returned to duty or received appropriate medical evacuation. Commendation letter from Naval Special Operations Command JSOC Task Force 121 noting that Senior Chief Torres' actions prevented mass casualty incident and preserved critical intelligence. Hargrove's jaw clenched so tight his face looked skeletal. He tried to speak. No words came out. By that afternoon, a SEAL team leader named Lieutenant Commander Webb was standing in the lobby of Oak Creek Memorial in civilian clothes, jeans, gray t-shirt, the kind of understated presence that somehow commanded the room anyway. He'd served in Rachel's task force. He'd watched her work in the chaos of Helmand province. He walked into the administration office and sat across from the hospital's chief medical officer and said quietly, 18 soldiers. That's how many came home alive because of her. During Operation Enduring Shadow in 2020, we were engaged in a siege that lasted 72 hours straight. 7 of those 18 had injuries that should have been fatal. She didn't have a sterile OR. She didn't have modern equipment. She had field expedient supplies and hands that were steady as surgical steel and a level of composure that comes from having already survived the worst. He paused. He looked at the CMO like he was measuring whether the civilian could understand. She saved lives that nobody else would have been able to save. And you fired her because a man with a malpractice problem wanted her gone. The CMO's face went white. By dawn the next day, 2 FBI agents appeared at Oak Creek Memorial carrying a warrant and questions about Dr. Hargrove's billing practices. What they didn't know yet, what nobody knew yet, was that Marcus Chen, the hospital's IT specialist and a Desert Storm veteran who'd heard the stories about the nurse who'd saved the sergeant, had spent the previous afternoon creating redundant backups of every security video from the hospital. He'd documented Dr. Hargrove's attempts to delete the footage from Surgical 4. He'd saved the timestamp logs. He'd preserved the audio of Hargrove threatening Rachel, his voice like gravel in a drain, unmistakable and damning. When the FBI agents plugged in Chen's hard drive, they found everything. Phantom procedures billed to Medicare. Kickback arrangements with a medical supply vendor. For years of fraudulent documentation. Hargrove's medical license was suspended by Friday. The board members who'd answered his country club calls, who'd been prepared to support his version of events, quietly submitted their resignations when subpoenas arrived. The outside risk management consultant discovered his firm was named in the federal investigation and stopped answering his phone. By the following week, Dr. Marcus Hargrove was no longer a physician at Oak Creek Memorial. He was no longer a physician anywhere. Rachel was reinstated with a formal written apology from hospital administration, though she declined to return to full-time work. The Navy had opened a formal review of her case. There were preliminary discussions about return to active duty status. She was taking it one day at a time, which meant she was buying groceries and sleeping for 8 hours straight and finding that the weight she'd been carrying for 3 years was starting to shift, just slightly, off her shoulders. 6 months later, she was walking past a community college campus in downtown Denver when she glanced through a ground-floor window and stopped moving. Dr. Marcus Hargrove was inside, teaching CPR to a room of disinterested students, demonstrating chest compressions on a plastic dummy. His hands were shaking. His voice lacked authority. He was earning minimum wage teaching the basics of resuscitation to people who were taking the class because their employers required it. Rachel watched him for exactly 3 seconds. Their eyes met. She wasn't sure he recognized her at first, and then she saw the moment recognition flickered across his face like a match going out. His hand stopped moving. The plastic dummy lay on the table in front of him, motionless. Rachel's face showed nothing. No satisfaction. No anger. No emotion at all. Just calm acknowledgement of a man watching his entire world collapse under the weight of his own choices. Then she turned and walked away. 8 months later, Rachel stood in her navy dress blues at a Pentagon ceremony, a uniform fitted so perfectly it looked like it had been tailored yesterday instead of years ago. The Secretary of Defense approached her with the formal respect accorded to warriors, and pinned a Humanitarian Service Medal to her chest. The citation read aloud emphasized her life-saving work both in active duty and in civilian medicine, a sustained commitment to preserving human life under the most extreme circumstances. Sergeant Reyes stood in the front row in his own dress uniform, tears streaming down his face as he saluted. Captain Sophia Reyes stood beside him, also saluting. The room erupted in applause, from Navy brass, from veteran advocates, from the 18 soldiers Rachel had saved in Helmand, several of whom had flown to the Pentagon specifically to honor her. That night, Rachel stood in her apartment and opened the shadow box she'd mounted on her living room wall. Inside lay her worn combat boots from Helmand Province, the leather creased and stained and irreplaceable. Beside them lay her Navy Cross and her 2 bronze stars. A photograph of her husband James in uniform was positioned in the corner. And there was a handwritten note from one of the soldiers she'd saved, received just last week, that read simply, "Thank you for my life." The next morning, her phone rang at 6:52 a.m. It was Sandra, the charge nurse from Oak Creek Memorial. "I know you're on leave," Sandra said, her voice moving fast, "but we have a mass casualty incident coming in. Highway pileup on I-70. Multiple traumas. We're going to be overwhelmed." Rachel was already reaching for her keys. "I'm 20 minutes away," she said, and hung up before Sandra could apologize for asking. She arrived at Oak Creek Memorial to find chaos and purpose colliding in the emergency department. Ambulances were still unloading patients. The triage area looked like controlled disaster. When Rachel walked through the doors in her civilian clothes, jeans, dark shirt, nothing identifying her except the way she moved, the staff parted like water. They recognized her now. Senior Chief Petty Officer Torres, not the ghost, not the temp nurse nobody remembered. A young resident froze during a difficult intubation on Trauma Bay 3. Rachel stepped in without a word and guided his hands with calm authority, teaching him the way she'd been taught, the way she would teach others for as long as she could draw breath. As the sun rose over Denver, Rachel stepped outside the ER entrance for air. Blood dried on her forearms. Her shirt was sweat-soaked and stained. She was exhausted in the way that comes from having done something that matters. Sergeant Reyes appeared beside her. He'd been volunteering at Oak Creek Memorial as part of his recovery therapy, and handed her a cup of terrible vending machine coffee in a white styrofoam cup that was somehow perfect. They stood together in silence, watching the sky lighten from gray to gold to full morning light. "Thank you," Reyes said. "For everything." Rachel took a sip of the coffee and felt her shoulders drop just slightly. "Just doing my job," she replied. If you're watching this story, if it reached something in you about the quiet strength of people nobody notices, please subscribe and share this with someone who needs to know they matter. Leave a comment about a time someone unexpected turned out to be exactly what you needed. Because the truth is simple, heroes walk among us. Sometimes in scrub saving lives in the dark.